Good day, class. We're looking at check call care for an unresponsive person. As you can see, I'm laying on the floor. Remember, when you look at this scene, you're not in the picture itself. The two people are the participants that you do see. So what I'd like to do, one is, again, make sure at any time you're confused, you email me. We'll work through this. I know it's hectic times. I know you're busy. Some of you are doing a number of other things outside of school. So please email me. The portal's a main site, but email is important. So here we go with today's check call care, unresponsive person, and we'll talk about heart attacks, all this building up to CPR, mouth to mouth, obviously, and working with an AED. Here we go.
Everything looks okay over here. No apparent hazards.
We're looking at hazards right now. I see an open flame.
Nice work. You've identified the flame as a potential hazard.
So we still go to the left. Is there anything?
No hazards on this side of the room. Good work. You checked the scene and identified all potential hazards. While checking, you didn't notice any severe life-threatening bleeding. Select Trey to move a little closer and check for responsiveness. Before you do that, you should check to see if Trey is responsive.
Okay, this is Trey.
Trey is not bleeding and seems to be unresponsive, but now you'll check for responsiveness. This will help you figure out if you need to call 911 and get an AED and first aid kit and determine how to provide effective care. For adults, loudly shout, "Are you okay?" Then tap the shoulder and shout again, this time observing the person's breathing. Check for responsiveness and breathing for no more than 5 to 10 seconds. Give it a try now. Select Check for Responsiveness from the menu near Trey's head.
You're asking
Trey did not react when he shouted.
Didn't react.
Try tapping his shoulder and shouting again, this time observing his breathing. Trey did not react when you tapped his shoulder and shouted. This means he is unresponsive. Did you notice his gasping? This indicates that Trey is not breathing normally, which means you should continue to provide care as if Trey isn't breathing at all. You need to contact EMS personnel and get an automated external defibrillator, also known as an AED, if one is available. For this emergency, you should send the waiter Bert to call 911. Take a step back by selecting the back arrow in the lower left corner of the screen. Select Bert, the waiter, to talk to him and send him to call 911 and get an AED. When sending a bystander to call 911, it's always a good idea to also have them grab a first aid kit if one is available.
Click on Bert.
We don't have an AED, but I'll call 911 right now.
Great job. EMS personnel should be here soon. You are ready to begin providing care. In this case, that means starting CPR. We'll stop here and review what you learned about the check and call steps in the check, call, care process.
Okay, again, check the scene and the person. Call 911 or local emergency number. Care for the person. In this situation, it looks like we may have to start with CPR and possibly an AED. But he's not in cardiac arrest at the time because we heard labor breathing. So we'll get to that point. So we're going to return home. We're going to pause.
A cardiac emergency
Okay, we're looking at cardiac emergencies.
When an injury or illness causes a person's heart to stop functioning normally or stop beating altogether. When a heart is working normally, it beats evenly and easily with a steady rhythm. When the heart isn't working normally, a person's breathing can be disrupted or stopped. And if a heart stops beating, this means cardiac arrest has occurred. Being able to recognize the signs and symptoms of a cardiac emergency could enable you to save a life. Let's take a look at one of the most common cardiac emergencies, the heart attack. A heart attack occurs when blood to the heart is interrupted, causing cells in the area to die and the heart muscle to become damaged. One major symptom of a heart attack is a tightness, pressure, or pain in the chest that continues or comes back despite resting or taking medication. Pain may spread to the shoulder, arm, neck, jaw, stomach, or even the back. Some people suffering a heart attack may feel dizzy or sweat heavily. Both men and women can experience similar symptoms of a heart attack, like chest pain, although fewer women experience chest pain than men. Other symptoms can include shortness of breath, nausea or vomiting, pale skin, sweating, anxiety, back or jaw pain, and unexplained fatigue. If the person is responsive and able to chew and swallow, a suspected heart attack can be helped with 2 to 4 62 milligram low-dose aspirin or a single chewed 325 milligram adult aspirin if available. Only give aspirin if the person is responsive, able to chew and swallow, and is allowed to have aspirin. To make sure they can have it, ask if the person is allergic to aspirin, has a stomach ulcer or stomach disease, is taking any blood thinners, or has ever been told by a doctor to avoid aspirin. By recognizing the signs and symptoms of a heart attack, you may be able to help someone suffering from a possible heart attack and prevent cardiac arrest. Sometimes cardiac arrest is unavoidable. This is where the cardiac chain of survival comes in. The links in the adult cardiac chain of survival offer the best chance of survival. You play an important role in the first 3 links. These links include early recognition of cardiac arrest and activation of the emergency response system. Call 911 or the local emergency number as soon as you recognize the signs of cardiac arrest. Early CPR, cardiopulmonary resuscitation, or CPR, is a life-saving technique that keeps oxygen-rich blood flowing to the heart and brain. Early defibrillation, an electrical shock called defibrillation, may help restore an effective heart rhythm. An automated external defibrillator, or AED as they're commonly called, is a device that administers a shock. Early advanced medical care. EMS personnel can provide additional life-saving care and transport the person to the hospital for more advanced care. And finally, integrated post-cardiac arrest care. Once the person is resuscitated, medical professionals stabilize their condition, minimize complications, and diagnose and treat the cause of the cardiac arrest. Notice that each of the first 4 links begins with early. That's because the faster you recognize signs and symptoms and react, the better chance a person has to survive a cardiac emergency.
Okay, so the briefing of this summary, as we look at, let me make sure this is visible here. Occurs when the heart is not working, normally, or when cardiac arrest occurs and the heart stops beating or cannot circulate blood to vital organs. You can read through this, look at the symptoms. Again, early is a critical piece of this information. I'm going to stop right here. We'll come right back.
First,
Okay, we're going to look at our skills right now.
Form an initial impression. Not quite. First, check the scene for hazards.
Always check for
No
hazards.
hazards over here. Everything looks okay over here. Good work. You checked the scene, and it looks like there aren't any hazards present. While checking, you didn't notice any severe, life-threatening bleeding. Next, you need to obtain consent from Cameron in order to provide care. To obtain consent, explain who you are, your level of training, what you see and what you plan to do, and ask if you can help. If a person verbally or visually agrees to care, this is known as expressed consent. If a person is unconscious or unable to respond, this is implied consent. If you're providing care to a child or infant, you can obtain consent from a parent or guardian if one is present. If no parent or guardian is available, then consent is implied. So, how should you obtain consent from Cameron? Yes, please. Now that Cameron gave his consent, you should use the acronym SAMPLE to interview him about signs and symptoms, allergies, medications, prevalent medical conditions, last food and drink, and events leading up to his condition.
If you recall, we had this a couple weeks
will
ago.
help you
Sample.
provide care. What should you ask Cameron first? My chest hurts, and I'm having difficulty breathing.
The S for symptoms. Okay, so we have some choices here.
No.
That's the A. So we're looking at the M.
No.
Now the P. Implied, we're looking at, ask if he has any medical conditions.
No.
Last food or drink.
Had grilled sausage and a fried egg this morning.
Shouldn't have gone against doctor's orders, I guess.
And of course, the event or leading up to, we say,
Me and my buddy were on break eating lunch, and I got what felt like really bad heartburn.
As he answers, you observe that Cameron's skin is pale. This sign and his described symptoms are common indicators of a heart attack. We'll stop the interview and have Jamal alert EMS and bring an AED and first aid kit right away.
okay, so he's responsive, and it's not a cardiac arrest, but he might be, as you know, because the heart did not stop. He's talking, he's communicating. So, and he's implying that there is an issue. So let's go. We're going to send Jamal to call 911 to get an AED at first aid.
Yeah, no problem. I'll call right now.
Normally, you would start providing care for Cameron while Jamal is on the phone with 911. But for now, listen in on that call to learn more about the kinds of questions you'd be asked by a 911 operator.
This is 911. Where is your emergency?
232 Wilson Avenue. I'm at the construction site right across the street from Greens Galore Supermarket.
What is the phone number you are calling from?
It's the landline here. 555-555-1234.
What is the problem? Tell me exactly what happened.
My coworker is complaining of chest pains. I think he may be having a heart attack.
How old is he?
He's 56.
Is he responsive or unresponsive now?
He's responsive.
Is he having any difficulty breathing?
Yeah, it seems like he's having a hard time breathing.
I'm sending paramedics to help you now.
Good work. Jamal is going to get an AED and first aid kit.
So we did 911.
Jamal has already left to call 911.
So we
You've
looked at the
already checked
scene.
the scene.
We already checked the scene.
In a cardiac emergency, you should make sure the person is comfortable. Cameron is seated comfortably on the wall, so have him stay there. You don't want him to strain to move anywhere. It's also a good idea to loosen any tight or uncomfortable clothing in order to make the person feel as comfortable as possible. If the person is allowed to have aspirin, you can give them some when it's available.
Check here. If it's acceptable, we're going to administer 2 low-dose chewable aspirin, and we're looking at that because it's also a blood thinner.
Good job. It's time to monitor Cameron.
And over here, it's going to talk about monitor.
Nice job. Now continue to monitor Cameron until EMS arrive to take over. You should be prepared to perform CPR and use the AED if Cameron loses consciousness and stops breathing.
Okay, we're going to pause there. So the next part, if you do have your book, we're going to look at cardiac emergencies from chapter 6, and we look through CPR. If you don't panic. I'll be giving you quite a bit of information to deal with this. We'll look at breathing emergencies, cardiac emergencies, 6, 7, choking, and then chapter 8's on bleeding. So we're going to deal mostly, as I had mentioned, with CPR, AED, but as of today, what you went through, I will throw some questions at you for you to answer at the end. Remember, a couple things. One is always go to the portal. Coursework could be under. Always check unit in detail. Okay, that could be under course organizer. And make sure if you're having a difficult time accessing any type of that piece of information, you email me. I wish you all the best. Again, don't panic. Again, as you look at this mission completed, look at that page. You completed this. We talked through it to some degree, and we're ready now for the next part. We'll be dealing in with CPR. Have a great day. I will follow up with questions, and again, check your portal. Always your emails as well. Mr. Grove signing out. Straight A's, everybody. Relax.